Hello, I'm Jeffrey with Habibi's Home Medical and Habibi's Durable Medical. And today we're going to talk to you a little bit about wheelchairs. This is the most requested item that we've had requests for from our subscribers and from people that have just watched our videos. So we're going to go over these. This particular item is a standard weight wheelchair. A standard weight wheelchair, you'll notice, has the pleather or leather-like back and seat. The lightweight, which is kind of a misnomer because it's only about 2 pounds lighter, generally has a nylon polyester weave in both the seat and on the back. One thing about these is we send them out, all of them, with leg rests. Generally speaking, we give folks the swing away leg rests that are just small like so and can be swung out and lifted off. But in some cases where we have patients that have injuries to their legs that require them to elevate their leg, we have what's called the elevating leg rest. Now, to fold this wheelchair to make it more easily transportable, we generally tell people to remove the leg rest. It's a couple pounds that it takes off of the weight. Grab the chair from the middle of the cushion or the seat, lift, and then you're ready to go. An easier way to roll this when you're moving it is just to lean it back so the front two wheels, which are casters, don't get caught up in one another. One other little trick for transporting this thing. We generally tell folks that when you are transporting this chair, rather than put this in their trunk, which would require that you lift the entire wheelchair up and throw it in your trunk, what I have people do is take it and lean the wheelchair back like so, roll the back wheels up to the back of the car, put the front two wheels into the back car well, where your feet are, put it in, lift it, and roll it right into the back of the car. This takes a lot of strain off the patient's caregivers or the patient themselves if they're the one trying to put this in there. So that's just one of our little pieces of advice. Now, to fold this wheelchair out, we push this down. Anytime that you are going to be sitting in this wheelchair, we highly, highly recommend that you lock both of the wheels out like so before you sit. This keeps the wheelchair from sliding out from underneath you and then ending up with more potential damage to the patient. And keep it set until you're ready to move. When you are ready to move, your hands go on the drive wheel, which is the inner, smaller wheel around the rubber wheel, and you push yourself. Some people do what's called foot pedaling, which is to use their feet and pull themselves or push themselves along. What this does is allows you to get around a lot easier. This chair in particular is one from Drive, and it comes with a nice feature whereby the patient can remove the armrests and change them to directions to have them as desk length or table length or desk length, like so. The advantages to having them, as I lock it away on myself again, is that when you have them on the desk length, like so, this allows you to roll up closer to a table for eating, etc. Another item that is common with these wheelchairs is the cushion. This is a standard cushion. It's just foam on the inside. These generally last 6 months to a year, and they're only covered once every 5 years by Medicare and Medicaid. But they go into the seat with the tag in the back. And the way that you are going to get one of these particular wheelchair cushions is to have your doctor note that you need a wheelchair cushion on the prescription, and either you're sitting in the chair for more than 2 hours, or you've got the start of a skin breakdown, which would necessitate one of these foam cushions. They do make cushions of higher quality, and by higher quality, I mean they spread your weight across a greater area. These are called air cushions. The most famous brand of these air cushions is called the Roho cushion. And these are inflatable. They pump up. They've got a rubber bladder on the inside and a cover. And so you can pump them to your desired firmness, and they spread across the entire sacral area so that you avoid skin breakdown. To qualify for a RoHo cushion or an air-filled cushion, your doctor must denote A, you have multiple stage 2 skin ulcerations or a single stage 3 ulcerations, a stage 3 ulceration. So what we do with these is we get these out to folks. Now, one tip I will tell you, with this standard weight in Arkansas, Medicaid requires a prior approval for this particular item. If you are wanting to get a lightweight wheelchair, your doctor has to denote a lightweight wheelchair on the prescription, plus let us know as a durable medical provider that the patient is incapable of propelling a standard weight wheelchair with their own strength. A lightweight wheelchair is also generally immediately approved by Arkansas Medicaid, so that is one of the other things that you need to know. With a standard weight, it's a prior approval, which can take 2 to 4 weeks, and a lightweight is immediate. We thank you guys for tuning in today. We'd like to have you visit us at gohhm.com. And if you have any questions or comment, we ask you to put them in the space below, and please subscribe if you want to have more content like this. Thank you so much for your time. Have a great day.